evening. Thanks for being with us this Monday night. You are with the Urban Debate. I'm Seher Zama. As we've all been aware, it's been a weekend of marking and many even celebrating the historic launch of the Ayushman Bharat Yojana. It promises to be the biggest social security for the poor of our country, to make healthcare affordable, accessible to them. While it is on one end fair to scrutinize its shortcomings, but there's been an unfortunate politicization to this as well. Today there are a total of 5 non-BJP state governments that have rejected the scheme outright on some excuse, some reason, some justification or the other, saying that their own state schemes are far better, and they're accusing Modi Care to be a mere jumla.
6 महीने के भीतर दुनिया की इतनी बड़ी योजना, जिसकी कल्पना से लेकर के करिश्मा करके दिखाने तक की यात्रा सिर्फ 6 महीने में है.
On the debate tonight, 5 states have decided to opt out of Ayushman Bharat, the world's biggest government-sponsored healthcare scheme. In Delhi, in a tweet, Arvind Kejriwal snubbed Modi's healthcare scheme, calling it a jumla. Neighbour and Congress-governed Punjab has also raised reservations about the scheme. Telangana and Odisha have also given the boot to the national healthcare scheme, claiming that they have state-run health schemes that already serve the purpose.
मुंबई हो, बेंगलुरु हो या कोची हो या कलकत्ता हो, वहाँ जो लोग उड़िया लोग काम करते हैं, वहाँ के अस्पतालों में भी अगर आयुष्मान भारत रहता उनकी चिकित्सा हो पाता. अभी उड़ीसा वाले कार्ड में वहाँ तो चिकित्सा हो नहीं पाएगा. नुकसान किसकी होगी? उड़ियाओं की होगी, सामान्य लोगों की होगी, गरीबों की होगी.
The 5th state to reject the scheme dubbed Modi Care is CPIM-ruled Kerala. Top ministers here have called the scheme a farce. As 5 non-BJP states reject Modi government's healthcare scheme, Mirror now asks, is petty politics taking over healthcare?
All right, let's throw this open to our guest to discuss this further. We have Mr. Sudesh Verma, National Spokesperson of the BJP with us, Dr. Ravi Malik, CMD of the Radix Hospital, Dr. R.N. Tandon, who is the Joint Secretary of the IMA, Manpreet Sandhu, spokesperson of the Punjab Congress, and Akshay Marathe, spokesperson of AAP. Since today they were discussing why certain opposition parties have chosen to reject this landmark scheme outright. So let's begin with the opposition tonight. Let's make a start with Mr. Manpreet Sandhu of the Punjab Congress. Help us understand what really are the shortcomings that you have understood of Ayushman Bharat Yojana so soon for your government in Punjab to have rejected it already.
See, there are lots of shortcomings in the scheme overall in the totality. Firstly, coming to the fixation of the ceiling rates for the premium to be paid, that has not been fixed till now. It is a very, very crucial figure. Till date, the rates have not been fixed as to what will be the premium and what will be the outlay in the entire gamut of the scheme. Secondly, the exact data of people to be covered under the scheme is not verified till date. The Modi government is depending on SCCC data of 2011. The data was published in 2011 and the figures were of 2008 and 2009 or 2010. That data is being used to calculate the total number of beneficiaries in the country. And that figure is not right. They need to go in for a new data. Trust me, this is another monumental disaster in the making via the organized loot method, which has been masterly crafted and by the NDA government. There are lots of other points which we
Okay,
can
so
talk about.
that being your
The
specific
basic facts and
criticism,
figures
your
are
government
totally
in
wrong.
Punjab has also said that they're not satisfied with the 60:40 ratio between the centre and the state government to be funding this.
Yes, it has been very rightly pointed out by our health minister that the benefits are being given to northeast states, border states, J&K, Himachal, claiming to be hill states. Punjab is equally a border state. Punjab has fought the biggest war on terrorism for so many years. And now the border problem is also another reason for Punjab struggling to fight against narco-terrorism, the drugs issue which has directly affected the health of the state. Now Punjab has bore the brunt of all these things for decades now. But when it comes from the central government to discriminate...
All right, so you're saying this should have taken into account also minute management of aspects specific to one particular state. Akshay Marathe, spokesperson of the AAP, help us understand why Delhi Chief Minister, why your leader has called this a jumla, saying it is too little too late.
First of all, let me state on record here that our government, the Aam Aadmi Party government in Delhi, is known for its commitment to education and healthcare. So it's not that when we are doing, saying things about a healthcare policy, it's not that we are indulging in politics. We are very serious about this issue. At the outset, let me say that any one of us who has used private medical insurance, if anyone on your panel or any of your viewers have ever claimed insurance from a private insurance company, you will all know that any such insurance scheme is inherently incentivizing fraudulent escalation of costs. So when you go to a hospital and you have an insurance scheme that is being covered, the hospital is likely to escalate your costs more than it would have otherwise. So when you have a socially funded insurance scheme like this one, it's more dangerous because it's taxpayer funded money that is going to be wasted in such a scheme. On the other hand, look at the model that the Aam Aadmi Party has used in Delhi. What we are doing in Delhi is that without having an insurance scheme, today if a Delhi resident needs tertiary or secondary healthcare, they can walk into a government hospital, and if the government hospital does not have the capacity at that moment to deal with that problem, they can refer the patient to a private hospital, which the government has an arrangement with to pay for completely. So even today, as things stand, without the Ayushman Bharat scheme, the Aam Aadmi Party has worked out a fantastic arrangement for the poor residents of Delhi to get universal healthcare coverage. The second thing I want to make, second point I want to make about this scheme is that it completely skips the problem of primary healthcare services. If you look at the healthcare costs of any average Indian, the most money spent is out of pocket is when you go to a private doctor for your primary healthcare. What Ayushman Bharat doesn't take into account is this problem that there is not enough government primary healthcare facilities, which also the Aam Aadmi Party has tried to solve by introducing mohalla clinics. So our limited point is that we in the state of Delhi for the last 3-4 years have invested heavily in healthcare, which means that we do not require the kind of fraudulent means that are going to be used in this kind of a scheme. We have our own investment, we have our own setup. And that is the model that we think should be adopted across the country, that we should invest in primary healthcare.
That's right, but just today, Akshay, you would be aware that just today you have the Delhi Chief Minister asking for Delhiites to donate land for more mohalla clinics. So it is as much a participation or land being taken or given out to the government here to in fact make mohalla clinics a further success. Let's get in the defense. We have Sudesh Verma of the BJP national spokesperson with us. Sudesh, if you've heard a listen in, just a sample of the nature of criticism. Okay, Sudesh, what would you like to say in defense of the Ayushman Bharat Yojana on aspects of what certain state governments who, of course, are headed by the opposition feel that this is no good, this has been blind to a certain aspect, and really pointing out various shortcomings? Sudesh, is my voice going through? Sudesh, that question for you, please. Okay, we're going to be reconnecting with Sudesh Verma on that in just a bit. But let's also get in a word here from the private sector. We have Dr. Ravi Malik, CMD of the Radix Hospital, in stating how certain private hospitals are going to be uncomfortable with the rates for at least a certain set of surgeries that have been suggested under the Ayushman Bharat scheme. Help us understand, Doctor.
Look, one thing is very clear that this scheme is wonderful. It is phenomenal. If it is implemented nicely, it is going to definitely help the poor people. Now, if we take a poor person who is a rickshaw puller or a labor class person, he has very less options available in front of him in case his family member gets sick. I will tell you the data that almost 18% of the urban population and almost 25% of the rural population, they take loans to get the treatment of their relatives or relations done. So it is a very, very pathetic situation, and this kind of a scheme is required. So it is very clear that this kind of a scheme is really required in a developing country like India. Now the second thing is, definitely as far as the packages are concerned, some of the packages are very low. It might not be possible for the hospitals or doctors to discharge the duty. Yesterday also, as I told you, that supposingly you take in terms of the cesarean section, the rate of 9,000 is very less. So, because so many things are involved, so many specialists are involved. If a cesarean is being done, there are 4 specialists who are involved, 4 days of stay is involved. So, some of the rates are very less. But above all, the basic thing is that it is a good scheme. At least it should be, we should start implementing it, and along the way, a lot of teething troubles are likely to come. Any time, any way, whenever we are going to launch a government project, a lot of problems are going to come. But by and large, one thing is very important, that this is required. And moreover, the sensitivity of the government towards
this is required, and give it some time. Give it some time to roll out, settle into the system before rejecting it outright. Appreciate that word. Let's also get a word here from Dr. R.N. Tandon. He's the Joint Secretary of the IMA, the Indian Medical Association. And remember here, the IMA initially, soon after the announcement that was made by the government, before it was rolled out this weekend, initially the IMA had said that the rates are unviable. Eventually, they came around it. Dr. Tandon, help us understand, how did IMA decide to come around it despite saying the rates for certain surgeries is unviable? Very similar to what Dr. Ravi Malik has just expressed.
The most important thing is, first I'd like to correct that I am Secretary General, not the Joint Secretary. I am Secretary General of Indian Medical Association. And the important thing is when we have been discussing about Ayushman Bharat with the Niti Aayog and the Ministry of Health, and every time we have been discussing how to roll out this scheme and how it should go and reach to each one. Rather, you can say at the end of the line, everyone should get affordable and accessible health care. So the affordability is now coming directly from government, not from a patient's own pocket. And the other thing I like to say that we have been assured that the packages which are very low, they will be corrected once we get the costing mechanism into place. The costing mechanism has been started by government, and they very well understand there is a problem in the packages, and they are ready to accept that. And on a number of occasions we have been assured. And the other thing is, look, the people who are getting treatment today, those who are being covered by this scheme, is nearly 40% of Indian population. So they are practically getting treatment at their places through small and medium-sized nursing homes and hospitals. So our interest is that the money should be reimbursed in a fashion so that they can sustain their services and they can continue serving the community which is coming to them. So our aim is that we must enforce that the packages are improved, and we must go into the discussion and discuss about how to come out with the better packages so that each and every medical specialties who are serving in the remote areas and other areas where these people are going to come to take the services, they keep on getting services, because these are the backbone of Indian healthcare. Everybody understands the 70% is coming from the private sector, and the private sector, the 65% which is in a rural area, has to be given some importance, and that's what has been accepted by the ministry, that they will take care of all the small and medium-sized nursing homes so that they should not collapse. And the other important thing is what has been missing. The primary health care is the most important. Even we have requested government that 150,000 centers which they are going to organize a wellness clinic, they should involve our general practitioners who are working in those areas. They should be attached to these wellness center, because ultimately we have to create a good referral system for the secondary and tertiary care. If we provide a better primary care, we can prevent so many diseases, we can diagnose so many diseases at the primary end, that the secondary and tertiary care will be, number will come down. So that is the most important thing.
We understood your point well. Let's get in Sudesh Verma, BJP spokesperson, to react to that. Sudesh, if you heard the nature of criticism, specifics that have come in, at least from the states that have outright rejected, in a total of 5 states across the country who were quick to reject it. This is going to be operational tomorrow onwards. How prepared are we on ground? There are hospitals, there are practitioners who are still unaware of the workings of it, still unaware of the people who are listed on this, who can avail of the Ayushman Bharat Yojana. We're looking at preparedness now on ground tomorrow onwards.
First of all, you see, is the biggest health care scheme ever launched in any part of the world. The whole world body recognizes this. 10 crore families would be covered. So we assume that the average membership of family is 5, but it could be 10 also. In that case, the number would go up. It gives a combined insurance of 5 lakh rupees. And if I can tell you that this knee-jerk reaction from states are not going to help, because people are going to force them to implement it, because the states have a golden opportunity to take this opportunity and ameliorate the plight of people. You see the data which I have, which is the National Sample Survey Organization data, that says that 85.9% of the rural household and 82% of the urban households do not have access to healthcare system. If such is the situation of this country, then any scheme that gives a comprehensive health assurance to the family should be welcome. So far as the question of nitpicking is concerned, of course the Constitution of India was implemented. After that, so many amendments happened. So because of fearing amendment, if the Constitution was not implemented, we would have never become a republic. So let us not get into that. Get it implemented. If there is any loophole, the government will plug the loopholes. And so far as the pricing and all the criticism is coming, you see, don't look at from the metro angle. Look at it from the angle of a poor person. You see, we have brought down the cost of knee transplant.
Right.
We have brought down the cost of a stent. We have brought down the cost of the medicine. And we have a national plan to have a super specialty hospital in every district. We are going to invest massively in public health care, which was ignored till now. So this is going to gel with this Ayushman Bharat scheme. It's an evolutionary step. Before criticizing that, please read into details, because we have taken so many months to implement this, so that there is no loopholes left. We understand the criticism, but let it roll out, and then you will see that there is no room for criticism.
Right, but Sudesh, don't you think that the government should have spoken to other states more often before releasing the final model and having it operational tomorrow onwards itself? Because these are specific queries and concerns that have been raised by the state governments, the respective state governments here, saying that it's going to be a further burden on the state budget. We already have health schemes which are operational in the state.
If they have better scheme, They did not implement it. It's the people who will force them to implement. Because we know Orissa government is saying that they have 7 lakh for women. But what about the whole family? You don't have any scheme. When we have brought this scheme, we have studied everything. There is no scheme better than this scheme. And it gives you a comprehensive insurance to poor family. We are not talking of rich people. We are talking of 10 crore poor families. And it is calibrated.
Can I come in?
So those who are opposing, you will see they will be forced by the circumstances to adopt it.
Manpreet, let me get to specifications. Let me get to specifications here. Does your state health program, does it have pre and post hospitalization expenses covered? Does it have transport allowance provided? Does it also provide portable benefits from public to private health centers? Do you provide an Ayushman Mitra or a state representative to help the poor understand what kind of schemes it has access to as far as state health schemes are concerned? Does the Punjab state health government scheme provide all of this that Ayushman is providing?
Yeah. Now coming to this thing, except the Ayushman Mitra concept which they have just introduced, the scheme which Punjab government is already providing to the people of Punjab, we cover almost all these aspects. This Ayushman Mitra concept is a new concept introduced by this NDA government this year. And just to correct them, till now, till date, the Ayushman Mitra concept has not been finalized as to who will pay the administration charges, who will pay the salaries, who will do the nitty-gritty about that Ayushman Mitra. Till date, nothing has been clarified. Firstly, secondly, what I would like to
do we have
reply
a clarification? Do we have a clarification on that, Sudesh? Are we looking at a health cess that is going to be funding this?
Can I ask a question?
No, let me complete. Can I
give a counter to that?
Okay, Manpreet, complete your point.
Complete, please.
Okay.
Now coming down.
Just in a bit. Manpreet, please complete your point.
Coming down to the facts and figures of the beneficiaries. Yeah, coming down to the facts and figures of the beneficiaries, Punjab is already giving this benefit, the benefit of this scheme since 2005, 2008 and 2015. We are in continuation. The number of beneficiaries in Punjab is about 30 lakhs. Whereas, as per the Ayushman scheme of this NDA government, the Prime Minister scheme, they are relying on the SCCC data, which only and only allows up to 14.96 lakh beneficiaries. So what do we do with the rest of the 15 lakh 4,000 beneficiaries who are already getting benefits under the various schemes of the state governments? This data of theirs is all fudged up figures. They do not have the ground reality in mind.
All right, Akshay, you wanted to step in.
Allow me to come in, please.
What really is the Delhi government providing the poor today? So you could respond to both Manpreet and Akshay in a go. Akshay, what is the Delhi government health schemes providing today which you feel is far better? Because there are rates which have been fixed, they are being worked out with the private sector as well. We are beginning with the data which exists, which is already at hand in 2011, that can be updated next. These are smaller issues. Anyone listening to the criticism that's coming in from the opposition would feel that these are small, workable issues that can be settled when we set the ball rolling. At least allow the ball to roll.
No, we have certain fundamental disagreements with the approach of the NDA government. It's not about the nitty-gritty only. It's about the approach that they have taken, which is that instead of choosing to expand and strengthen the existing government infrastructure, what they have decided to do is to stop the project of strengthening government infrastructure and outsource this entire thing to the private sector. Healthcare is a subject which I believe and our party believes is one of the most important duties of any government. We are tax-paying citizens of this country. We deserve certain services from the government free of cost, and which is the model that India has always had. In Delhi, what we do is, let me give you an example. Let's say today you have an ailment, you can go to your neighborhood Mohalla clinic, you will get all tests done for free, you will get all consultation for free, you will get all diagnostics for free. Then, if let's say if you need secondary treatment, they
No,
will
that is
refer you
all
to a
pre and
polyclinic,
post
which is the next
hospitalization
level.
expenses
The
are
polyclinic
also
will have
taken care of by the
specialist
Ayushman
doctors.
Bharat. Let's in fact have
No, hear me out.
Let's in
Hear
fact
me-
have
hear
Dr.
me-
Dinesh
hear me out,
Arora.
hear me
He
out.
is the deputy
Hear me out.
CEO
Let me
of
just
the
finish my
Ayushman
point.
Bharat with us.
Allow
Stay
me-
with us,
allow me
Akshay.
to
Some of
finish-
that
allow me-
criticism
can
should
I-
be
I am
heard
not
by
able to
Dr. Dinesh
outshout-
Arora as well. Dr. Arora, appreciate you being with us. A lot of criticism that we are getting in today from these 5 states of the opposition who've decided right from the start that this is no good. We're doing much better. We don't need a scheme from the central government. What would you like to say on issues that they've raised as far as the rates that have been announced, which are unviable, as far as not further developing the primary sector, the primary healthcare center, instead going straight out and working on the next level? Also on how this is going to be operational tomorrow itself. There are people working in government hospitals across the country still not aware of the workings of this, on how to make this happen on ground. Dr. Arora.
Thank you so much. I think I'll answer all these things in one by one. First, I think point raised was about the costing.
Okay.
We have been very clear in this scheme that we have come up with the base rates. The base rates are above the base rates can be the outcome based health incentives. That is, if you have moved towards a quality hospital which has an NABH certification or an accreditation, you get about 15% higher rate. If you have a teaching school like you have a MBBS or a DNB, you get another 10% higher. If you are in an aspirational district or in a backward district, so another 10% higher. So rates are actually have a base rate and incentive based outcomes are attached to it, whether it's quality, whether it's a teaching school or whether it's a backward area. In addition to this, we have also given the flexibility that if state wants to have more further rates to be increased, it has been given flexibility. If they have any existing scheme and the rate of that scheme can be applicable for them. For example, in Chhattisgarh, they had a procedure for bypass rate was 1.1 lakh. Our base rate was 90,000. We gave them the flexibility. So this is first, that flexibility has been given to all states to decide on their package rates. Also, they can reserve the package rates. They can reserve certain procedures for public hospitals only. They also can have a referral system for private hospitals. Like for example, a person can first go to only private government hospital, and if the facilities are not there, they can be referred to the private sector, like Karnataka wants to do that. Second point is talked about the primary health care. I must tell you that Ayushman Bharat has 2 pillars. One is the health and wellness centers, and the second is the Pradhan Mantri Jan Arogya Yojana. So the health and wellness center talks about 1.5 lakh sub-centers and PHCs to be upgraded into modern facilities, which are happening. About more than 2,500 have already happened. The timeline is up till 2022. About 1.5 lakh PHCs and sub-centers shall be upgraded. And the second leg is the curative part, where we're talking about the secondary and tertiary hospitalization. So if anybody is criticizing that the primary health care or promotive health care is not part, I think they're misinformed. There are 2 legs. One leg was inaugurated on 14th of April by the Honorable Prime Minister in Bijapur, and the second was inaugurated yesterday. What was the third point you had raised?
If we're looking at private hospitals to come on board in supporting this, what's in it for them? What are the incentives for coming on board? Because they anyway feel that the rates that have been fixed for these surgeries are far too low.
I think we have a difference of perceptions only here. As I already said, 1, the state governments have been given the flexibility to increase the rates. 2, we have got tremendous response. As of now, we had got 24,000 applications, 20,000 valid applications. Valid means which have PAN card and bank details there. As of now, where we stand, we have more than 13,000 hospitals empaneled, 9,000 government and 4,000 private. So huge response. Now, when we have an application for a private hospital, there's a district empanelment committee which verifies whatever has been quoted there, and then it goes further to the state empanelment committee. So this is work in progress. As far as I understand, there's a huge, tremendous response from most of the stakeholders to join the scheme.
Okay, there's a criticism specifically that's coming from the Punjab government here as far as funding goes for the states, between the centre and the states. It's a 60:40 ratio. So many states, of course, these are belonging to the opposition, have been saying that if we're already satisfied with our state government health schemes, why then pitch in and allocate our state budget for Ayushman Bharat Yojana as well? What would you like to say to that?
I think most of these states are already using the Rashtriya Swasthya Bima Yojana, which was part of the government of India, whether it's Kerala, whether it's Odisha, or very recently Punjab was also using it. And number two, this scheme adds a lot of value into it. Not only the two pillars of this, the most important pillar is the portability. If a person from Punjab goes to Goa and falls sick, he can avail benefits in any of the empaneled hospitals across the country. The similar is if anybody from outside comes to Punjab and falls sick, can avail the benefits. So it becomes a part of the network and everybody gets benefited there. So there's a huge potential. This is perhaps one unique feature which no other state scheme can follow. Also, I'm aware of the Punjab scheme since I'm a doctor and I have many medical friends in Punjab. You will be surprised to know that in Punjab, hospitals have not even received payment for more than 6 months. While in this scheme, we have made an automated thing that within 15 days for normal cases and 30 for portable cases, all hospitals shall receive the payments. In fact, when we had stakeholder
Alright, so that of course was one of the concerns that was raised as far as receiving payment well in time. Yes, go ahead.
Their main concern was that if they can get payments on time, they are willing to work at these rates.
All right, Manpreet Sandhu, you've heard the explanations here that have come in. Is this really a case of a lack of understanding of all that the scheme is providing? Is that where your criticism is coming from?
No, not exactly. I'll tell you. Firstly, I would like to point out that the BJP and the Prime Minister says that this is the biggest scheme rolled out and till date in healthcare and all that. Just to remind them, Punjab was one of the first northern states to roll out this scheme under the leadership of Captain Amrinder Singh in 2005 under the name of Sanjeevani Health Scheme. Then came 2008 Rashtriya Swasthya Bima Yojana by the Government of India, that was under the UPA. So after that in 2015 Punjab had another scheme by the name of Bhagat Puran Singh Bima Yojana or whatever. Now the thing is, what we are pointing out is that as GST was a monumental failure, this is another monumental failure because these guys, they do not have their facts right at all. Now I've heard one or two panelists speak about primary health care. What I would like to point out is, in this year's budget itself, 2.1% reduction in allocation to the National Health Mission. And National Health Mission is the largest program for primary health infrastructure in the country. So, where is the vision of the Modi government towards the health sector if they are reducing?
It is still taking into account. It is still taking into account upgradation of primary health centers. Where is the money coming from? Sudesh, if you could answer that, please. Larger concern on who's funding it, what is funding it, where is the money coming from?
The whole
Manpreet, we got your point. Let's have Sudesh respond to that.
The whole issue is I find complete lack of understanding of this monumental scheme. You see, these 5 states supposing if they have a better scheme, let the people decide. No. If they had a better scheme, then tell me how 86% of the rural household and 82% of the urban household did not have access to any health insurance or assurance. Tell me how it happened. If Delhi is giving a fantastic healthcare system, let the poor people of the country benefit from it. Delhi is anyway pampered a lot. Its per capita income is more than many parts of the country.
No, so but Sudesh, if you could specifically answer. Sudesh, there is still a large question mark or an area of doubt on where the money is coming from.
Can I answer this question?
You know that the BJP will walk away with all the credit that these states are opposing. but people will force them to implement
Dr.
it.
Dinesh, yes.
That is the
very
beauty of democracy.
specific
Can I answer this
question, Dr.
question?
Dinesh, on where the
I
funding
think,
is coming
about-
from. Where is the
I'll
money
answer about
coming
the
from?
factual part
It is
here.
ambitious. It is an infrastructure upgradation.
Somebody
Yes.
said. Somebody said that the budget has been slashed. I think they are
There
comparing.
I'm also on the panel, just
the
reminding
budget
you.
estimates with the revised estimates. So
Right.
3,500
it's
crore
not-
in this
it's not that
fiscal
the
is
budget
going to
slash
be
is there.
spent
Plus, please
on this
understand,
scheme.
1%
For your
cess has
information.
been 1% cess has been. Can I complete? I don't interfere in when others speak. Please, can I speak, please?
Right.
1% cess has been
cess,
put up,
health
which has a
cess,
health
right.
component, which will roughly calculate to 11,000 crores. So this is why, because this scheme, we are
Okay.
not sure how much this is going to account for. What are the rates which are going to be discovered for those schemes which are going for insurance, or those states which are going for trust. So that is why the government has very smartly put up a 1% cess of the,
Thank
which
God
is
he has
amounts to about
agreed that
11,000
they-
crores.
that they do not
so
have the
whatever
basic
amount
facts
is
and figures
required, that
verified
scheme,
till
that
now.
Okay. Manpreet, let him complete his point. Let him complete his point, please.
Can somebody please understand that when we implement a health protection scheme, it will depend upon the usability, the utilization rates. So we can have an actuarial part done, but actual will depend upon the actual utilization, how many states join, how many states roll out. So it's very natural that a 1% cess has been allocated, and we have been given a blanket check by the Ministry of Finance that whatever funds required for Ayushman Bharat shall be allocated. The first tranche of money has already been released on 15th of this month, before 1 week before the launch. So I think money and money is not an issue at all.
Okay. Akshay, yes, you
Allow
wanted
me
to
to come
step
in. I've
in
been waiting it
in
out.
continuing to insist.
Can I come back?
Yes, Akshay, as AAP continues to insist on why the Delhi
1 second.
government schemes dedicated to health are far better than this scheme. Go ahead.
Yeah, so I'm going to reiterate the point about universal health coverage. You see, of the 10 crore families that are being covered under Ayushman Bharat, Delhi has about 50 lakh families in total, of which only 6 lakh families will be eligible for the Ayushman Bharat scheme. To counter that, look at the policies that the Delhi government already has. Every resident of Delhi, no matter what your class is, no matter what your caste is, no matter what your religion is, gets access to all of the benefits that are provided under Ayushman Bharat already. The Delhi government is already paying for it. We have already expanded our healthcare budget by about 50 to 60% in the last 3 years. So all of these benefits, right from primary healthcare centers to the secondary and tertiary healthcare in our government hospitals as well as in private hospitals, is already available to every single resident of Delhi. We're not differentiating people based on what their incomes are, what their family backgrounds are, because we believe that if people have paid taxes, they deserve government healthcare services. That is the fundamental model on which the AAP government is operating, which is why we don't believe in the model of the Ayushman
Dr.
Bharat,
Dinesh,
because
are we
it
going to
creates a
have,
special class of
this is
citizens.
specifically for the poor, are we going to have an Ayushman Bharat Yojana for the middle class as well?
Look, I don't want to get into a political debate, but let's keep some facts very clear. You know, for last 60-70 years, we have been doing a supply side financing, where we say that we open up hospitals, we are supplying more doctors, more nurses, more paramedicals. What have the findings come out? The findings say that the lowest 20% use only 2.2% of the services.
No, sir, we have not invested
and
enough
the
money.
Upper
We have not
20%
invested
use
enough money.
6.4% of the services. So that 3%, there's a 3 times difference of utilization between the lowest most and the highest most. So most of the schemes which come with an open end are not targeted. Most of the benefits are then acquired by those who are in position of power and prestige. Now, Ayushman Bharat brings up a 40% dedicated only for the bottom 40% of the country, a fully targeted approach, which covers both primary as well as the secondary and tertiary in the form of Pradhan Mantri Jan Arogya Yojana. Plus also, what about the portability of the scheme? Moreover, many people from outside will come to Delhi. If there's a government joining Ayushman Bharat, all those people will also get benefit. So are we talking about regionalism here? Are we only worried about somebody staying here? What about, those jhuggi jhopdi people who are coming from Uttar Pradesh, coming from Haryana every day and working in Delhi, if they fell sick, who is responsible for them? So perhaps I think this scheme for us was very clear.
Every single
Even the
person
Prime
who has
Minister
a voter
reviews it,
ID
he
card in
just says
Delhi
that this
has
scheme
access
is to be taken
all
as a mission.
facilities of the Delhi government.
Since there's so many
I'm not
doubts
here
being
for a
raised,
political debate. I
mostly
just
wanting
want
to
to
get
comment on my
clarification
take
on this. My next question again to you, Dr. Dinesh Arora. As far as the middle class is concerned, we're of course willing, very much so, to contribute through that health cess to make this happen for the poor. We are well aware of that, and we are absolutely equal players in making this happen. But there are larger concerns of the middle class as far as us suffering from the system here as well. There are issues of medical negligence. There are cases of illegal profiteering by private hospitals. These are concerns then that are being raised by the middle class on when will we benefit from something that the government can do on as large a scale for the larger middle class of the country as well.
I'm sure you will still be very happy that the scale it is. It's the third largest nation which we are going to fund right now, 50 crore, 55 crore individuals. Please understand, Honorable Prime Minister from the ramparts had already said that this is going to be an aspirational scheme. So very soon we will have another layer coming over it, which the middle class will also be covered. But please understand, this is also giving an economic models. What we are emphasizing in next 3 to 4 years are 2,000 more hospitals being opened in rural areas, especially with the incentive-based outcomes which were coming on. That means incentive to hospitals to open more teaching schools. So we'll have more doctors, more nurses, more paramedics, more consumables, more injectables. At present, we are looking at those people who perhaps had never been able to get the treatment they wanted. Have you heard in rural areas talking about a bypass surgery or talking about maybe an implant, the knee implant? But this scheme has all those, including the cancer treatments, which is daycare also. So I think what we are moving towards is an aspirational model. Once this scheme gets stabilized, next wave will move towards the middle class, and the larger aim, perhaps I feel, is by going towards a universal health coverage.
All right, next wave for the middle class. Very, very heartening to hear that, Dr. Dinesh. Appreciate you saying that. Dr. Ravi Malik, on what has been explained on incentives that are going to be offered to private hospitals to come on board to make this happen, were you satisfied with that response?
Look, the thing is, definitely the rates of certain procedures are very low. It is difficult on certain procedures for the hospitals to discharge the services, but I am skeptical about two things. Number one, if we see the numbers, 5 lakh rupees are sanctioned per family, and 10 crore families will be given this facility. Now, supposingly, every family, they claims only 1,000 of rupees, not more, not 5 lakh, only 1,000. And people are going to come with claims. Because in our country, there are a lot of waterborne infections, mosquito-borne infections, then a lot of serious infections. Joints are going to be replaced, then livers are going to be replaced. So many things are there. If only 1,000 rupees are being claimed by per family, it will come to 10,000 crores. And the total budget is just 5,000 crore, as I've come to know from the panelist discussion. So the only issue is the base of this scheme lies on the number one, on the funding,
please let's get
and number two, on the infrastructure. Now the second thing is, if 85 to 89% of the people are not accessible to the healthcare, right now the infrastructure, the availability of the doctors, the nurses, it is very less. So how we are going to increase the infrastructure, number one, and number two, how this funding challenge will be addressed.
That's what Dr. Dinesh has just responded to, that they're also looking at partnerships in getting trained personnel on ground to make this happen here as well. So Desh, I'm coming to you in just a bit, just a few seconds. Dr. Tandon wanted to step in here, Secretary General, as you said, of the IMA. Dr. Tandon, all aspects, doubts, criticism that have been raised by our panelists have been answered, taken care of here by Dr. Dinesh Arora, who is the Deputy CEO of Ayushman Bharat, with us as part of this panel. But Dr. Tandon, as far as portability goes, rates being viable eventually across the board and further smoothening the process, in how much time, from your experience, do you really see this working out on ground, showing results on ground in terms of unnecessary, avoidable deaths that we report in our country every day? There are diphtheria deaths of 18 children that have been reported in Delhi. Encephalitis deaths each given season take place in various areas across Uttar Pradesh. Zika virus deaths take place as well. Is Ayushman Bharat also going to cater to these?
In fact, the important thing is that the present infrastructure, which is already serving the countrymen all over the country, I'll say until and unless you utilize all those services, whatever you are saying, whether diphtheria or whether the encephalitis, each and every patient has to be seen by some of the facilities available in that area. And so the present infrastructure, as Dr. Ravi Malik was saying, there is no infrastructure, but I'll say the infrastructure which is already existing, that should be given importance to implement the scheme, and then only it will be possible to run the scheme. And the most important thing is definitely when we are taking care of a primary care, primary health care, and the preventive measure will take care of sanitation and healthy and safe drinking water. These two things will definitely lead to reduction in the diseases which are spread by vector-borne and the water-borne. So both the diseases can be controlled and can be initially treated if the facilities are being provided, the sufficient funds to run the services. That is the most important thing. The scheme has got no bad thing, but definitely the bad thing is only the packages and the way it is being implemented. I think government is trying to hurry it up. Just I don't know why. This scheme should have been launched by government some 2-3 years ago so that they could have seen what are the problems and what are the teething problems and how can they improve further on this scheme.
Okay, so that's of course a criticism that is coming by AAP as well, saying it is too little, too late. Rather,
they are just trying to push it very fast.
I have to take in a view from our caller.
Yeah, it's
Dr. Tandon, we got your point, please. Our viewer has called in Dr. Venus John from Mumbai. Please go ahead.
Hello. Yes. First of all, I must thank Mirror now for. First of all, I must thank Mirror now for having this debate because it increases awareness, among people, and you're asking the right questions. Why the middle class should not get the facility, etc. But I'll just tell you my view. I feel this is an excellent scheme. Even though if you see the numbers, it's not workable. It's workable because even if half the families, half of the 10 crore families, utilize even 1 lakh rupees per year for their hospitalization charges, even then it will come up to 5 lakh crore, and the government is just giving a fraction of that. So so practically it is not workable. So I can understand why the
all right, so once again the criticism here coming in as far as the mathematics of this is concerned. Sudesh, would you like to respond to that? We Indians are very good with our numbers here, and we're pretty certain the maths is not really adding up.
Of course. You see, you can be very sure that the government must have calculated these basic issues which are being raised. It's not that the government would not be aware. Government is aware of the behavior pattern of people also, how Indians behave also, the nature of illness also, how much it will cost also. As was rightly pointed out by Dinesh ji, that one person says gives you 11,000 crore, the government is giving all the backing. If needed more will be given, because first turn is of the poor people. If any in your panel or among those who are asking question, if you can get any poor person, they will tell you what happens if there is illness in the family. The entire budget is destroyed. The family gets into the debt trap. It is initially for them that now at least they feel secured. There is immense amount of social security which the government is giving, and it is for them. Eventually, people ask about middle class. Yes, it should be extended to the middle class also. Let us see how this scheme is accepted. Let us see how it rolls down, and what is the response. Then of course it will be extended to the middle class also.
Okay. All right, final word here to Dr.
The
Dinesh
track record of
Arora.
this government
As
when
an
it comes to
advice to those
demonetization,
states, to those
GST,
political parties
in
here
all of these schemes
who've
of the
been
Modi government, the track
opposing
record
it.
is that they do not think through any of these schemes, and they end up changing rules, especially when it came to Notbandi, GST.
Akshay, I'm afraid we'll have to be a bit more positive about this instead of making it sound as absolute doom, because clearly this is a well thought out scheme. There is something working for this for the poor. Dr. Arora.
I'm not a cheerleader of the BJP. I'm not a cheerleader of the
I think as we are debating today,
no one is a cheerleader of any political party here.
Today, there have been. As we are talking today, more than 1,000 people took benefit of the Ayushman Bharat scheme today. More than 1,000 people have got benefit today. About more than 10,000 people got registered today in different hospitals across the country. I think we all need to come together. This is a well thought out scheme. We have worked out our mathematics, actuarials have been worked out. Let's start implementing it. This is going to be like a white revolution, green revolution. This is not an on and off switch, This is a work in progress. A scheme gets started. It will evolve itself. It will have some teething problems, but we need to manage them. Today we have a state of art infrastructure in the term of beneficiary identification system using Aadhaar and non-Aadhaar. We have online health hospital empanelment systems. We have a state of art transaction management system, which can raise even a deemed claim, and payment needs to be paid within a limited period. So I think we all need to come together and implement this scheme, and let's ensure that the last person in the line that gets the benefit. This is what perhaps is my advice to all the political parties. Thank you.
All right, Dr. Arora, appreciate that. On that positive note, I'm afraid I'll have to leave it at that. We'll all have to come together eventually to make this happen, including the taxpayer. Appreciate all those voices that have come in, and for all who've been criticizing it, we must remember this figure. There are nearly 27% of the total deaths in India that happen because of no medical attention at the time of death. And this is according to figures. This is according to the 2013 data which was released by the Census Directorate. So when you have government programs that are largely focused in the past on communicable diseases, very little attention that has been paid to affordable surgeries, and Ayushman Bharat attempts to take care of this aspect as well. So let's try is our advice tonight to those opposing this. Thanks for being with us.